Good afternoon, everyone. When I introduce myself as a person working in the field of rural healthcare, it evokes a range of reactions amongst people. How often do you hear someone introducing himself or herself as a person working in the field of rural healthcare? It is very interesting. Try it sometime. When you go to a party, introduce yourself as a person working in the field of rural healthcare, and you'll save a lot of long conversations. Because most of the time, the other person you shake your hands with will say, "Oh, nice to meet you," and he or she will slowly move away. And if you introduce yourself as a person working in community-based rural healthcare, it is very likely that not only the person will slowly move away, but you will also not see him or her throughout the party. Because it doesn't sound that fancy. It doesn't sound that glamorous. But I'm going to refute that. I'm going to dispel the notion that it is dull. It is not. In fact, it is the opposite. When was the last time you lost your sleep for something that is not directly related to you, but something related to your community? Can you think of that? When was the last time? It is very difficult to remember that, isn't it? Because we don't normally lose sleep for things that directly don't matter to us. Well, 10 years back, when I met these two gentlemen in one of the rural villages in Sindhupalchok, the person at the right, Mr. Shankar Lama, he was telling me, "Doctor, I have problems sleeping at night these days. I can't sleep well. Because what bothers me is that there's a small community-run health center that we have been running for several years, and it is almost at the verge of getting closed." This was what he said. The person at his left, Mr. Dev Khadka, the paramedic staff working at the center, reaffirmed the concern and said that the only hope of healthcare in that rural community will soon be closed. The integrity you could sense in their character, the sincerity of the purpose they had in their words, and the sense of dedication you could feel in that conversation. It was very compelling to us. It was very compelling to us to work with them to revive the center. And we did. We rallied our friends, our partners in Nepal, outside Nepal, collaborated with many, and we did manage to revive the health center. At that time, nobody knew that 6 years later, that center would be the place that would save hundreds of lives in the 2015 earthquake. So every village has a hero. Every community, every village has a hero. When you think of a community, what comes to your mind? We tend to think communities are groups of very similar people. But that is not true. Every community is like an orchestra. It's a combination of diverse set of musical instruments. It's a combination of diverse musicians. And the key thing is to find out who is the conductor of that orchestra, because that will help you shape the melody. Every village has a hero. The hero doesn't need to be the richest person in the village. The hero doesn't need to be the most educated person in the village. He or she might be a school teacher, a poor farmer, a shopkeeper just around the corner, but someone with the vision, the commitment, the sincerity of the purpose. this was one of the first exciting things I learned when I started my career in rural healthcare almost 16 years ago in Dhulikhel Hospital. You know, that time I was a fresh, young medical graduate, and I was responsible for setting up, building, and running the rural health program of the institution. So that meant I had to engage myself with different communities in rural Nepal and create health facilities, health programs in collaboration with the parent organization, Dhulikhel Hospital. It was an exciting job, and I was very confident, ambitious, proud at that time. And I felt with the knowledge and skills I had gathered when I was 24 years old, I'd be able to solve any problem. There wouldn't be anything difficult for me. And actually, it didn't take me a long time to realize that was wrong. The knowledge and skills I had acquired, were not adequate. Let me show this picture. I'm here at the far right side in that picture. So we were traveling to one of the rural villages during my work, and the car got stuck nowhere. And we found some villagers and managed to get a rope that they used to build swings in the village, and they helped us to pull the car out of the mud. And I was so scared, because I was scared when they pulled the car out of the stuck place, it might shoot off and hit me. So I was literally running. So I'm showing this picture, not just to remind you of the incident, but actually to reflect my sense of helplessness when I was exploring these villages. I was traveling on and on, meeting a lot of different people from all walks of life, all types of people. And then I started to realize that the sets of problems and the issues that I had to deal with were so diverse. They're so unique to each scenario. And it was then I began to realize that every community is so different. It's just like an individual, just like a person. And that led to another exciting thing that I learned during my work. And it was the solutions to the problems are best found in the places where the problems lie. At one time, we were having a big meeting in the community. And we were talking about improving the access to healthcare amongst the villagers that were being served by our health center. And then the discussion was going on and on and on. We had lots of lofty ideas. And then slowly, one of the villagers stands up and says, "But sir, there is no bridge that connects a lot of different villages with your center. The old bridge that used to be there is already broken." That caught us by surprise. It was a remarkable insight to us. We had never thought of that. And then, in collaboration with the local community and with our partners in Nepal, outside Nepal, we managed to build a bridge. So this was the bridge. So it then opened access to hundreds of villagers across the river to reach to one of our health centers. Another time, we had a big meeting with the local women, and we were discussing a lot about how to improve healthcare, how to improve the services we had, and so on. And then slowly we started to figure out that it was almost impossible to isolate healthcare with community development. It was almost impossible to just single out healthcare from agricultural development, from women's empowerment. So what we had to do was we had to create a new model in which we could incorporate community development, agricultural support, and healthcare together. And we did that. We had more than 200 women included in the microfinance program. We provided trainings on agriculture to them. And then we involved them in various health education and also improved the health services in the community. This was like a piloting for us. And we worked with a lot of collaborators for this, not just the communities, but also our partners from the country, outside the country. And it was a new learning for all of us. We hadn't thought about this before. There are countless examples like this. Many, many examples where we had to create new models of success. And so that brings me to the third point, the third exciting thing about working in rural healthcare. It is that innovation doesn't mean only new technologies. You know, what bothers me sometimes is when we talk about innovation, we tend to talk about new apps, new devices, new diagnostics, new technologies. But in rural healthcare, when we talk about innovations, we need to talk about innovation in new systems, in designing new approaches, in designing new strategies. That is also innovation. When you integrate healthcare and community development, that is an innovation. When you build a new cadre of health workers in rural community to address a particular health problem, that is an innovation too. When you manage to bring agriculture and health together in a community, that is an innovation too. I'm not surprised when I hear a lot of the works done that led to Nobel Prizes were actually done in some of the most impoverished communities in the developing countries. Well, sometimes I wish that the organizations were also housed in those countries as well. But I really believe that a lot of these innovations happen in the resource-constrained settings. We may not be able to change the world, but at least we can create some models of success. And some of them might be replicated in other settings. I think that's the beauty of it. And finally, the fourth most exciting thing when working in the rural healthcare is the humbling experience that you gather during the work. It's tremendously humbling. You know, I hear people saying, I'm going to the community to serve. I hear groups saying, I'm going to the rural community to serve, do this and that. And well, most of them, when they return, you know what they tell? They say, well, I went to the community and I learned. That's the humbling experience. Imagine yourself spending time with people like this. They do not understand which universities you graduated from. They will not understand what degrees you have. They will not understand what awards and accolades you have managed to gather. They will not understand your publication profile. They will not understand your positions and titles. And when you work with them, it is then the real human self inside you emerges out. And you start connecting to them. And then you start connecting the dots. You start connecting the knowledge with action. You start connecting the ideas with impact. It is then you start creating opportunities in those settings where these people live. And you will start realizing the fact that there are opportunities, there are a lot of things that can be done even in those settings. And it is in these settings you will realize that what should be more bothering is not the magnitude of challenges we face. What should be more bothering is actually the ignorance of the opportunities we have. Thank you very much.